Welcome to Thursday's edition of COVID-19. Our daily tally continues to hover on the 700 level, with most of the new infections centered here in the capital area. Accordingly, the planned ease in social restrictions for this region has been delayed by a week. Now, we have more on that later on in the program. Here first is the extended pandemic update with our Kwon So-ah. Now, So-ah, then, do start us off.
All right, Sunny, we are seeing a decline by around 30 infections compared to yesterday, so really not much. We are having 762 cases reported as of 12 a.m., and that means domestic transmissions are also still in the 700s. We've also got quite a high number of imported cases at 50, with 27 of those from Indonesia. And the average in daily infections in the past week is at around the mid-600s, as we've been hovering between the 500s and also the high 700s. With that, as of this July 1st, Korea has a total of 157,723 infections with 2,021 COVID-19 related fatalities.
Right, and so with the new month, we're looking at some changes in social distancing guidelines, and more people are also poised to get vaccinated.
Right, Sunny. People like you and I are going to get vaccinated sooner or later now too, because more of the nation's general population will be subject to inoculations with the beginning of the third quarter. Although the first prioritized people will be those who did not receive their shots in the first half, and also followed by teachers of younger students as well as high school students, seniors of high school students, that is. And the government will have more details on that in its briefing later. Now, in the first half of the year, almost 30% of the nation's population has received at least one dose of vaccine. That's over 15.3 million, with also 5 million people having been fully vaccinated now. And also beginning July 1st, the revised social distancing measure has finally come into effect. Non-capital regions that were under level 1.5 will now be under level 1 according to the 4-tier system. And the capital region that was under the third highest during the 5-tier system at level 2 will be under level 2. But actual measures will take effect in a week from now. And that because the plan has been delayed a little due to the rising figures in the capital region. We're seeing 300s in the capital Seoul for the second straight day, and over 85% of cases today were in the metropolitan region. All of Seoul, Gyeonggi-do Province and Incheon are being affected by a cluster infection linked to foreign language teachers gathering that spread to many other places, and even 9 Delta variant cases were detected in those places at this cluster infection. And other places now are seeing declining figures, and that's also why, according to the new revised system, other regions will be able to have people gather in larger groups than before, and there will be also relaxed measures at high-use facilities.
I see. Meanwhile, on the international front, So-ah, fears are mounting over rampant transmissions at sporting events, I hear.
Right, Sunny. The Euro 2020 has led to an increase in virus cases in Scotland, as almost 2,000 Scots that have attended sports games or soccer games across the UK have been found to have been infected with COVID-19. And that also could be a sign for Tokyo, the Tokyo Olympics coming up, because rising figures in Japan, especially in Tokyo, may lead to an extension of the state of emergency into the Olympic season. So that could raise the possibility of non-spectator games. And let's take a look at the global figures and the daily increases. The UK has just hit 4.8 million infections, with over 25,000 cases reported in the past day. And we've got here India and Brazil with over 40,000 infections in the past 24 hours. And the total number across the world stands at 182.9 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, So thank you for now. Right, now for a closer look at the delay in the planned easing of social restrictions here in the metropolitan region, I have our Kim Sung-min here in the studio with me. Welcome, Sung-min.
Good afternoon, Sunny.
So the relaxation of COVID-19 regulations for the Greater Seoul area has been postponed, Sung-min.
Yes, Sunny. Plans to relax social distancing measures have been pushed back by 1 week in the Seoul capital area amid concerns over the outbreak here, with the region accounting for around 80% of all recent cases confirmed nationwide. The capital region had originally planned to allow private gatherings of up to 6 people from July 1st as part of a gradual shift to the full implementation of Korea's new social distancing guidelines on July 15th. But due to the uptick in cases, health authorities have put those measures on hold and will closely monitor the current outbreak for another week. With that, the restriction on gatherings in the capital area will stay as they are, allowing a maximum of 4 people to get together. Restrictions on business hours will also remain in place, which was supposed to be extended by 2 hours to midnight from the current 10 p.m.
Right, but a few other guidelines, Sungmin, are being implemented as planned here in the region, right?
Yes, Sunny, that includes the lifting of an outdoor mask mandate for those who have been vaccinated. Anyone who got at least 1 vaccine dose doesn't have to wear a mask when venturing outdoors. But the easing comes with a word of caution by the government, which recommends people to stay at least 2 meters apart when they're not wearing their masks. In other words, people should keep their masks on even when outdoors in an environment where it's difficult to maintain social distance. It's a view that has also been echoed by many health experts here. Take a listen.
I think it's a bit too early. Mask wearing is the most efficient virus prevention measure, so it should be the last to be lifted. So I think the government's set date for the new rule is premature.
Right. Now, meanwhile, Sungmin, authorities are looking to cut the red tape on clinical trials to facilitate the development of homegrown vaccines.
Yes, Sunny. The government on Wednesday announced a set of relaxed guidelines governing clinical trials for vaccine candidates. They will open the door to comparative clinical trials for Korean drug makers, which allow vaccine candidates under development to be compared to the ones already in use. The advantage of this method is that it only requires a relatively small control group of 4,000 participants. That is fewer than the minimum 10,000 subjects needed previously for a phase 3 clinical trial, so this is a welcome news for local drug makers who've been facing a chronic shortage of recruitment, especially as more people are getting vaccinated. And not only that, the guidelines will also allow the comparison of vaccines that are based on different platforms, and they also contain provisions for the testing of vaccine candidates against new variants.
I see. Hopefully we'll hear some good news in the near future. Now, also here, we have a sizable budget set aside for vaccines and containment efforts.
Yes, Sunny, the government has earmarked just under $4 billion in this year's second supplementary budget to support the country's vaccination and containment efforts. That includes financing to purchase vaccines and create the necessary infrastructure to distribute them. The government aims to secure at least 192 million vaccine doses by the end of this year and open 15 more vaccination centers nationwide. The goal is to vaccinate up to 47 million people, equivalent to around 90% of the country's population within this year, in response to the threat of current and possible future variants. Korea is also funding efforts to transform itself into a global vaccine hub that can provide a steady stream of vaccines for the benefit of its global neighbors. The budget will cover the cost of infrastructure and equipment needed for vaccine manufacturing, as well as the cost of clinical trials for homegrown vaccines.
또한 K-글로벌 백신 허브 구축을 위하여
We will inject roughly $180 million to support the production of vaccines and their source materials, cultivating experts in the field and subsidizing the cost of clinical trials by local drug makers when they eventually become ready.
Right, homegrown vaccines. All right, Sungmin, as always, thank you very much for the coverage.
Thank you.
Right, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Thursday. As mentioned earlier, the planned ease in social restrictions has been delayed for the Greater Seoul area, given the recent rebound in daily infections. Accordingly, the metropolitan region faces the former level 2 guidelines, meaning only up to 4 people are permitted to meet for social purposes. Initially, starting today, that is Thursday, there had been plans to allow a total of 6 people to socialize until the 14th of July. Also, restaurants, cafes and gyms can only operate until 10 in the evening, while clubs are to remain closed. Movie theatres and concert halls are required to leave 1 seat empty between patrons or parties. Sporting venues face a capacity of 30%, while weddings can host up to 99 people. Places of worship can fill up to 20% of their capacity. Now, after a week's observation of the current situation here, authorities will decide on the fate of COVID-19 guidelines for the metropolitan region starting from the 8th of July. Right, I understand the briefing is about to start. We'll come back to you afterwards.
그럼 먼저 정은경 청장의
First of all, we have Commissioner Jung Eun-kyung with today's briefing. Let us now begin our regular briefing for July 1st. Today is the first day of July and we will be rolling out our vaccination plans for the rest of the month. And also, as for the new eligible recipients, we also have some new announcements. Within July, our plan is to also inoculate those people who are subject to their first dose. So there are major 4 directions. First, those are the people who have not been vaccinated despite the fact that they were the eligible recipients in June. And to this end, we will also conclude our first half of the year inoculations. And second, we will also inoculate teachers and as well as senior students in the high school so that they could prepare for the upcoming college entrance exam. And third, we will also roll out the vaccination to the general public. And fourth, we will also grant more authority to the local governments when it comes to vaccination, and we will also enable the vaccination to be rolled out at businesses and corporations so that we can enhance access and also convenience of the vaccines. And here are also some details. First of all, as for those who have not been able to get vaccinated, despite the fact that they were the eligible recipients in June, we have had the booking process until the end of June, and they will be receiving their vaccine, the Pfizer vaccine, starting from July 5th to July 17th. And also there were people, the senior citizens who between the age of 60 and 74 who were not vaccinated due to their health conditions. And there are about 200,000 of them. And starting from the 5th of July, we will also roll out Moderna vaccines to this group of people. And as for these group of people, we will be having the booking process starting from the 12th of July going forward, and we will also provide individual text messages. And second, we also have our faculty members as well as high school seniors. And as for the high school seniors and faculty members in the high school, there are about 640,000 of them, and we will also have the coordinated schedule with the local education offices and the vaccination centers, and they will be administered with the Pfizer vaccines at each of the vaccination centers at the schools. And also about 150,000 high school seniors, they will be receiving the vaccines in August. We do not have the detailed plans as of yet. And as for the faculty members and teachers of primary schools and all the middle schools as well, and we also have about 1.12 million people, and we will also provide Pfizer vaccines to this group of people starting from July, and the booking process will be beginning from the 14th of July and 17th. And we also have newly inscripted servicemen who will be getting the vaccines, and this is aimed at reducing the infections among our military personnel. So before they are enlisted, we will be also providing them with vaccination starting from 12th of July. So anyone who are enlisted to serve in the military during the month of July, August, and September, we will be rolling out the Pfizer vaccines, and they will also need to submit their enlisting document and certificate to the local community health centers, and they will be vaccinated then. And as for our plans to vaccinate those people in the 50s, here are some details. Starting from July 12th, those between the age of 55 and 59 will get their vaccines first, and consecutively those in the age group of 50 to 54 will also get their vaccines as well in accordance. And also, the vaccination will begin starting from early August for the age group of 50 and 54, and all of these group of people will receive Moderna vaccines. And as for businesses that have large-scale businesses like automobile and shipyards, automobile manufacturers and shipyards. They will also have these local and business area inoculations, and we also will be providing the vaccination to about 44 businesses, subject to about 390,000 people, and they will be given the Moderna vaccine starting from July, and we will go in accordance with the plans to inoculate the general public as well. And next, we also have plans for the local governments, and considering the conditions and the characteristics of these local governments, we will also aim to intensify our protection for the senior, for the high-risk group, that is. And also starting from late July to early August, we will also give more autonomy to the local governments, and they will also be able to devise their own tailored plans, and also they will be provided with the vaccination supply going forward. And also, as for the characteristics of these local governments, the cities and the provinces, they will be able to come up with their own tailored detailed plans, and the Ministry of Administration, they will be looking over these plans. And the second dose of the AstraZeneca vaccination are as follows. And we also had an earlier meeting of the experts for the AstraZeneca vaccines going forward, and we have had a review in the age group for those who are subject to the AstraZeneca vaccines. And we decided that we will also suggest and recommend the vaccination to those aged in the 50s. And also the second dose will be given the Pfizer vaccine for these group of people who have already receiving administered with the first dose with the AstraZeneca vaccines. And also we will be looking at details of the ages, and we will also look at the blood clots. And starting from those aged in the 50s, we also decided that we will be increasing the age limit because we saw that starting from the 50s, there are more benefits than losses or harmfulness due to these vaccines. And as for them, they will be receiving the Pfizer vaccines as for the second shot. And according to our vaccination plan for third quarter, we will also provide more vaccines, AstraZeneca vaccines, the second shot to be given out at the places of correction and correctional facilities, and as well as other facilities. And at these places as well, they will be giving the Pfizer vaccines. And also starting from July, as these designated vaccination centers and hospitals will be rolling out more than 2 types of the vaccines at the same time, we will make sure that we also prioritize the importance of safety, and we will also devise detailed guidelines and plans to prevent administrative errors. And by the recipient, by age group, we will also give them stickers in advance that show which vaccine they are eligible for, and they will also need to wait at separated areas, and we will be providing some training and education based on these guidelines for all of these designated hospitals that will be rolling out vaccines. And if there are any occurrences of administration orders, we will also make sure that these revamps or also improvements and after responses are taken immediately, so that we will also have a revised scheme of the reporting of such an administration error. And as for the vaccination efficacy for those aged over the age of 60, we have some details. Right now, our vaccination rate has reached about 87.3% for these senior group people, and we are also seeing a drop in the infections among these group of people, which is now standing at about 4.4 per every 100,000. And this is especially true for those age group between the ages of 70 and 80. And also right now, the vaccination center for those under the age of 60 is only 10%. And in April, we have seen slight increase of the infections, and it is also very stagnant right now. And also we have been looking at the ages of some 14,000 infections lately, and also a majority of them were in their 40s, and followed by the 20s and 50s, and also 30s. And among them, we also see that below the age of 60, about 93% of them did not get their vaccines. And also we have seen that majority of them, about 91% in all age group, they were the people who have not received their vaccine yet. So we believe that in order to protect yourself from the COVID-19, it is very important that you get vaccinated. Next, we also have the fourth round of screening meeting for the compensation for the COVID-19 vaccination adverse responses. And we have had the fourth round of meeting, and we also have looked at about 200 reviews of 200 cases, and we looked at the medical response documents, and we also looked at the correlation with adverse responses with the vaccines, and we also decided that about 172 cases will be subject to a medical compensation, as for a financial compensation, that is, and as for the 2 cases, we decided that they will go on pending. And right now, we also have decided about 500 people are subject to these medical compensation due to some adverse responses from the COVID-19. And also we have been looking at our newly devised goals and also plans to provide the emergency medical support for those people who are going through adverse severe responses. And for all of them, we also have revised the plan so that they can receive about 50,000 Korean won of care person fees so that they could utilize such services going forward. And next, also as for the antivirus measures in July, we also have some details. The quarantine authorities, we will also look at the revamped social distancing scheme and the summer holiday coming up. And also we will be looking closely at the spread of the COVID-19 new variants here in the country. And especially after the month of July, until we reach a certain level of herd immunity, it is very important that we contain the virus going forward and maintain the current social distancing measures and the antivirus prevention measures as well. And also we need to bolster our monitoring for the new variants. And to this end, we will also expand the scope of people who are subject to regular PCR testings, and we will also utilize the issuance of the administrative orders by each of the local governments so that they could encourage more people to get tested. And we will also have special antivirus periods for such cities and provinces and local governments so that we can have an intensified crackdown on religious facilities as well as private cram schools and so forth. And if needed, we will also intensify and heighten the accessibility to the screening centers going forward. And as for the new variants that are spreading globally, we are also going to intensify our capacity to monitor these new variant cases, and we will continue to carry out our DNA testings. And as for the Delta variant, we will also contain the influx of these cases into Korea by bolstering our quarantine measures for those high-risk countries. And starting from July 1st, we will also have the lifting of face mask wearing mandate to all of the people who have been receiving at least one dose. And we also have been providing the details to each of the local governments. So this means that even that they are not wearing their face mask at outdoors, they are not subject to penalty or fines. And also as for the people who have seen the passing of 2 weeks after the inoculation, they are not mandated to wear face masks. And even when they are not wearing face masks at outdoors, they are not going to be subject to penalties. And however, at outdoor spaces, if they are participating in large group rallies or other places and venues that are crowded, they are also continuously required to wear the face masks. And especially when indoors that are crowded, if they don't wear their face mask, they could be subject to these penalties and fines. And aside from these penalties and fines, despite the fact that they have been vaccinated, we continue to highlight and we continue to recommend the wearing of face mask at all places where it's crowded. So regardless of your vaccination and regardless of the social distancing rules and the level, we ask you to wear your face mask as well. And especially this is true for indoor areas. The COVID-19 infections, we are also seeing 700 new daily cases for the past 2 days, and we are also very much alarmed at this increasing rate. And in the capital area, the total cases, they account for about 80% of the total cases, and especially the infections are spreading through young population, and we are also seeing the spreading cluster infections through cram schools and restaurants and so forth. And we are also seeing the Delta variant spread as well. Right now, we have about 9.8% of the total population who have been fully vaccinated. So this is comparatively low, relatively low compared to other countries. So we believe that until August, it is very important that we contain the virus further. And we believe that it is very important that we continue to monitor the situation here in the metropolitan area. And we will also devise new countermeasures. So we ask the public as well to refrain from having group meals and also face-to-face meetings, and also minimize any occasions that you need to take off your masks at indoor spaces. And we ask you to get tested if you have any clinical symptoms of COVID-19. And due to prolonged COVID-19, we understand that this is very challenging and difficult. However, for the past year or so, we have also made great efforts. And in order not to put these efforts in vain, please bear with us and please continue to wear face masks and comply with social distancing measures. And the quarantine authorities will also make sure that we continue to contain the virus and roll out safe vaccines.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Chong Young with Thursday's afternoon briefing. So what did she have to say?
Well, first off, I don't know if you have noticed, but the background of the briefing has changed a little bit today with some pictures that showed pictures and called on citizens to participate in vaccination, make sure to ventilate and also get tested when symptoms are shown, and also to wear face masks. And that was something that Chong stressed as beginning this July 1st, there will be incentives for vaccinated people. So she mentioned that there will be no penalties or fines for people who got at least 1 dose of vaccination and 14 days have passed if they're outdoors, but if they're indoors, they can be subject to penalties or fines. And also, she had the vaccination plan for this month, and I'm going to break it down into 4 groups. First off, the completion of vaccinations for people who did not get their shots in June. That includes seniors aged 60 and above. And then we've got senior high school students or people who are going to take their college entrance exams later this month, as well as teachers of younger children and instructors at daycare centers. These will all get the Pfizer shots. And then later on, the general public, beginning with the people aged in their 50s, will start to register for their vaccination. And the actual vaccination will begin for those in the late 50s in late July. And they are expected to receive the Moderna vaccine. And last but not least, autonomous vaccination by local governments and workplaces is also being planned.
I see. All right, so thank you very much for that.
My pleasure.
자유가 책임에 기반한 새로운 사회적 거리두기 체계는 장기화되고 있는 코로나19 유행에도 우리의 소중한 일상을 회복하기 위한 것입니다. 다만 새로운 거리두기 체계가 적용된다 하더라도 코로나 바이러스가 그 특성이 바뀌는 것은 아니며 개인 방역 수칙과 예방접종은 여전히 중요합니다.
The transition to normality is taking place in small steps in a growing number of countries as authorities seek a better balance between containment efforts and public needs. Now, for more on this reality and the challenges ahead, I have Dr. Kim Sing-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
And joining our session virtually is Sawitri Wongketjai over in Thailand. Hello, Sawitri.
Hello, thank you for having me.
Right, we'll start here in the studio then, Dr. Kim. What are your thoughts on the reality that the metropolitan region has been excluded from the planned ease in social distancing guidelines that was supposed to start here as well on this Thursday?
Well, first of all, I think this is the pretty good decision because considering the current situation, especially regarding the Delta variant, I think this the kind of just all the quarantine procedure we have done so far, we are kind of just accustomed. So in this case, instead of just implementing just a new policy or some guidelines, we are just doing just what we have done so far. So this is a little bit just easier for us to choose at this moment, and then to see what the global trend, especially regarding the Delta variant and others, then we will just choose what is the best way for us to do.
Right. And Dr. Kim, what are your thoughts on the debate over the lifting of the mask mandate outdoors for those who have received one dose of the COVID-19 vaccine?
I think this is sort of just the incentive for the vaccine recipient, and this is also being implemented in some foreign countries as well to just promoting just the vaccination as well. But I think we have to actually think about some basic principles. The masking is just a way of just protection ourselves and also just our neighbors. Most of the transmission occurs by just a lipid, just a droplet, just a transmission, and then I don't know exactly whether some specific experiment was done for this COVID-19, but for prior experiments it shows that the most droplet just travels just probably less than 2 meters and then the 6 feet. So that's why we are set some guidelines just staying away from each other at least 2 meters or the 6 feet away. So, but we have to actually keep in mind that this kind of the principle. So then, especially when the indoors, it is very important just wearing those masks. But outdoors, sometimes if there is some viruses like transmitted by some the infected people, the outdoors are pretty much just some ventilated. There's much wind, and then if there is any virus, the virus is easily just dissipated out to all the open airs. So there is a very small chance of transmission in outdoors. But especially like some very crowded places, even in some open space, there's still just a relatively higher chance of transmission. In those cases, just wearing mask is very important. So we have to keep this very basic principle in mind, so that we can just choose our the behavior based on this thing. And at least the wearing mask actually demands very least effort from ourselves. This is very easy for us to do. Just vaccination and other treatment options, hospitalization requires much more. But wearing mask is just a very small thing we can just do very easily. Right.
Meanwhile, Thailand continues to battle a third wave that has recorded some 4,800 new infections this past Wednesday alone, Sawitri. What is fueling the resurgence there?
Yes, the situation in Thailand are very concerning right now, because in June alone, we have about 98,000 new cases, and the number is still rising. And the reason for that is because it's arrival of the Delta virus. Now we have 30% of the new cases are Delta variants, and it's spread all over the country right now, especially in Bangkok. In Bangkok, we have more than 100 clusters. So, yeah, we still have to work on it.
I see.
And it's also the new restriction now that the restaurant can be open, but only for takeaway for the next 30 days, and also the construction camp in all over Bangkok has been closed for another 30 days.
I see. And against that backdrop, Savitri, Phuket is welcoming vaccinated tourists for quarantine-free holidays starting on this Thursday. How are people there responding to this move?
Yes, as a Thai people are well aware that tourist business is very important for this country, and if Phuket can manage to open the borders to welcome foreigner tourists again, that will be good for them, because they've been closed and no business at all for almost a year now. So, and the thing that we can do this because 70% of Phuket population has been already vaccinated, and about 1,400 venues in Phuket are certificated with CHA Plus certificate, which means the employees in that venues are 70% vaccinated. So it's safer for the tourists to go there. But it's concerning because there is still a lot of things that you have to do before you can come to Thailand. Like you have to be fully vaccinated, you have to get insurance, and you have to test negative for COVID within 72 hours before your departure. And during your stay, if you stay for 14 days, you need to get a PCR test on your own expense 3 times, which costs about $300. So, and we are receiving about 470 people today with 5 flights coming in, and we are expecting more flights to come in the next few days from Europe.
I see. Meanwhile, here in Korea, Dr. Kim, Korea is also opening quarantine-free doors to fully vaccinated travelers starting today, of course. But this is with the exception of countries like India, Indonesia, the Philippines and Pakistan, amid concerns over the Delta variant. But critics are pointing to the absence of the UK and Russia on that list. And these two countries are also seeing rampant spread of the Delta variant. What are your thoughts on this?
I think the authorities are considering the situation in those countries. I'm not quite sure about the situation in Russia, but at least for the UK, I think at least the UK is the country where the most vaccination actually just accomplished. So when considering the some current trend of the confirmed cases of COVID-19, also death rate, although the confirmed cases of COVID-19 is still just keeps increasing, but death rate stays just normal. I mean, just very low status. So I think that actually reflects the some positive effect of the vaccination, especially for some high-risk groups as well at this moment. So I think that the kind of a trend is actually reflected on the authorities' decision at the moment.
Right, and further broadening our talk, I have Daphne Tollis over in Greece joining us virtually to tell us a bit about the situation in Greece. Daphne, could you start off with the COVID-19 situation there?
Hello, good morning from Athens, Greece. So we are here, it's July actually, it's a day of extreme, let's say, heat. 43 degrees are expected today. The country currently counts, as of yesterday, 633 new positive cases and a total of 12,706 deaths. The vaccination rollout is proceeding. We have fully vaccinated 34% of the population. And for the first half of this year, at least 44% has received 1 dose of the vaccines.
Daphne, also today over in Greece, a new vaccine passport system goes into effect across the European Union. What is the general response to this?
So it's welcome here in Greece and of course in the other European member states and travelers that want to visit Greece. So last month, Greece launched this European Union's digital COVID-19 certificate, as it's called, to facilitate the travel process, basically, and welcome more tourists during this year's summer season. So today, in theory and in effect, it's the date that this EU digital COVID certificate enters into application throughout the European Union. But now, we have this Delta variant that has been alarming most of the countries. So Greece is currently re-examining rules for travel and restriction-free admission into the country after this Delta variant has emerged.
Right. And Dr. Kim, staying with facilitating regional travel, Korea signed a travel bubble with Saipan that is slated to go into effect later this month or early August. What are some of the precautions to take amid this move?
Well, the travel bubble is applied only for just a group travel, not for individual travelers. So in this case, maybe just there must be some sort of just guidelines for the group travel as well. And then I think there should be some kind of some PCR test in and out of the Korea, and also some. Well, I think it's still whether travelers is inside or outside of Korea, the personal the quarantine guidelines is still should be applied, wearing just masks and avoiding some crowded place.
Right. Meanwhile, Sawitri, we had Daphne talking about the vaccination campaign over in Greece. What is that campaign moving? How is it moving along in Thailand?
To reach the goal of 100 million doses by the end of this year, we should inject about 500,000 shots a day. But what we can do right now, the average we can have about 200,000 to 300,000 injection a day. So that's gonna take some time. The problem is not about the people that working on ground that inject with the injection. They are ready and they are capable to do 500,000 injection a day. But the arrival of the vaccine is slow. That's make things slower.
I see, which is a reality that most countries face at the moment. Daphne, it's been well over a year since the start of the pandemic. Are the public and authorities in Greece on a par with regard to efforts to seek a balance, perhaps, between containment efforts and normality, even amid the threat of variants?
So yes, and Greece was in a strict lockdown since end of October 2020. But as of mid-May, we have opened our country both for its citizens and for international travelers coming to Greece. So the restrictive measures are being relaxed gradually since mid-May, when we went out of full lockdown. So now we have ended the mandatory wearing of face masks outdoors. It's still that's happened last week. Nighttime curfew, which was previously into place, has also been lifted. Social distancing is always encouraged, and face masks indoors are still mandatory at all times. The other measure that Greece has introduced is for weekly self-tests that are required for employees working in restaurants, cafes, gyms, offices, any business that involves public and people interacting. So, but for the employees that are fully vaccinated, double jabbed, and at least 2 weeks have passed by now, these weekly tests are not mandatory. So, the vaccination rollout is proceeding, and more people are encouraged to go and be vaccinated. The rate is going pretty well. So then at restaurants and cafes and bars, it's summer here, so people are sitting outside, not indoors. We are not sitting indoors anywhere. But still, the number of people that are allowed to sit together has raised to 10. It was 6 up until last week. So, the sense of normality is restoring gradually with the safeguards still in place.
Right. And here in Korea, Dr. Kim, the plan at the moment is extensive easing of most social restrictions in most regions from mid-July. How feasible is this plan?
Well, considering that easing the current situation, I think we are concerned about some new Delta variant. So in this case, to come up with to face with this problem, the first one is we have to actually speed up the vaccination. The vaccination at the moment is also the Delta variant is actually some the worrisome situation. But according to the recent data, once we finish the vaccination, either just AstraZeneca vaccine or just Pfizer vaccines, at least the severity, the severe disease can be prevented by more than 90% of efficacy. So which is good. So the vaccines are still very effective, but just one shot is not enough. The protection efficacy is still just 30% or so. But for just once we finish that is very effective. And also as I said earlier, just the personal quarantine guideline is still very effective. The viruses just don't penetrate the masks. So this is very important.
Right, so have your face masks on.
Sure.
All right, Dr. Kim, as always, thank you very much for your thoughts.
Yep.
Daphne over in Greece, thank you for being with us at this early hour. And Sweet in Thailand, thank you for your thoughts and time as well.
Thank you.
Right, and that brings us to the end of this edition of COVID-19. Now, the planned ease in social restrictions for the Greater Seoul area has been delayed by a week, so do seek to abide by the current measures until July 8th. Thank you for watching.